Hello, this is Andre with Tongue Tales on Monday, and today's tale is about the tongue of a 38-year-old female with the chief complaint of multiple sclerosis. We have a confirmed diagnosis with the presence of brain lesion as seen on an MRI, and her notable symptoms include worsening of vision in the left eye, which is exacerbated by exertion. Now, let's see what her tongue would tell us. The coating of her tongue is peeled. That's a clear indication of yin deficiency. The tongue seems moist, which implies her stomach works well and generates fluids. The size of the tongue is small. There is not enough yin to expand the tongue or to thrust it out. We are certainly looking at yin deficiency. We can also observe spaces between the mouth side and the tongue's edge, here on the right and the left sides. This is another indication of yin deficiency. Shape. At the same time, we can observe that the sides of the tongue are slightly elevated, a sign of liver qi stagnation. We can also observe a slight tongue deviation to the left side. If you just follow the midline of the tongue, you can observe how it is being bent to the left side. Now, when the tongue deviates like this to the side, this indicates liver wind, a neurological component. We know we must strengthen liver blood and yin and extinguish the wind. Let us take a look at the tip of the tongue. The tip is slightly thin, so there is a slight heart blood deficiency. We would expect this patient to have some anxiety or sleep disturbances. The color of the tongue is dark red, which indicates we are dealing with empty heat. There is a slightly bluish tint to this color, so you may suspect that this deficient heat obstructs the circulation of blood. We can also observe that the edges of her tongue look redder than the rest of the tongue, a sign of liver fire. So we are dealing with liver qi stagnation, yin deficiency heat, as well as liver fire and liver wind. Next, let us observe the texture of the tongue. We can see irregular vertical and horizontal cracks in the proximal 1/3 of the body, which corresponds with the lower burner, the kidneys. This observation is not surprising and gives us further clues that kidney yin has to be nourished. However, what is really interesting is the horizontal crack on the side of the tongue, here on the right side. I attribute this crack to a long-standing spleen qi deficiency. We can also observe white, long, elevated points on the root of the tongue. Do you see them here? These arise in the presence of phlegm or dampness accumulation. In the context of kidney yin deficiency, liver fire, and liver wind, these spots suggest that despite the heat signs, there is also an underlying issue with fluid metabolism, leading to dampness or phlegm retention. This could be a response to the body's attempt to counteract the internal heat with more yin-like qualities of dampness or phlegm. We also observe some red points on the tip of the tongue, indicating the presence of some sort of heat in the lungs, because this corresponds to the lung region. We know that the Wei qi, which corresponds to the lung, defensive qi, is overexcited. We could see this as a chronic autoimmune condition when the body begins to attack itself. Finally, let's take a look at the sublingual veins. They are normal and unremarkable, which is a sign that blood stagnation, systemically speaking, does not play a big part in this presentation. Now, let's put it all together. We understand that at the core of this issue lies kidney yin deficiency. A deficient kidney yin is unable to nourish liver blood, which becomes deficient and causes stagnation of qi, which in turn generates heat and scorches the yin even further. Kidney yin deficiency heat and liver fire generate wind, which causes all the neurological symptoms in the head. We remember that the liver opens into the eyes, and a decline in visual acuity, especially when it's one-sided, is the function of the liver. We should also consider addressing heat in the upper burner, though it may be an issue we need to address separately. So, what herbs can we use in this case? We can take Ligustrum, Nugenzi, and Ecliptae, Han Lian Cao, which comprise a formula called Urge-1, the 2 ultimate pill. This formula used to nourish yin. These herbs are not cloying, so they are easy to digest. Therefore, they are the herbs of choice for a person with phlegm dampness accumulation. We want to add an herb that extinguishes wind. We can use Uncariae hooks, go Teng, because this herb extinguishes liver wind and treats whole array of neurological disorders. It also clears heat from the liver and anchors yang. Now, for a complete list of herbs in this prescription, please check the notes to this video. Also, if you have any health issue and would like to know what your tongue tells on you, please contact us. We have a link in the description to this video. Send us your tongue image and we will speak about it next. I am Andrei with Tongue Tales on Monday, and I will see you next Monday.